Hello, I am Dr. Harshalatha. I am an ENT surgeon and a head and neck cancer surgeon. So today I would like to tell you a few things about hearing loss in children. A lot of children as at their birth are diagnosed to have hearing loss which goes undetected till the time the child develops speech or when the parents starts to realize that the child is not developing proper speech. So this could be due to an early hearing loss, that is severe to profound hearing loss at birth itself, which goes undetected. So we can do something called screening of hearing as soon as birth, that is the otoacoustic emission. So which will show a basic result as to whether the child is having a normal hearing or not. If the hearing is tested abnormal or the patient had a failed response on otoacoustic emission at birth, that can be tested again once after a month's time, and also a standard investigation of BERA, that is brainstem evoked response audiometry, that can be done, which will show the amount of, that is the severity of the hearing loss. So any child who has been born to high risk mothers, like as in the mothers who have diabetes or preeclampsia, eclampsia, that is hypertension during their pregnancy, are advised to go through, those children, their children are advised to go through a hearing assessment as soon as birth. So the hearing loss, if there is anything, can be detected at the earliest and a proper treatment can be given to them. The treatment for congenital severe to profound hearing loss can be started as early as 1 year. There is something called cochlear implantation that can be done. Cochlear implantation as in an electrode, that is a wire that is inserted, that is put in the inner part of the ear, which will go and stimulate the hearing nerves, which will help in hearing. The earliest the cochlear implantation is done, the better are the results in the speech outcome. That is the reason why a hearing assessment has to be done at the birth. There are some hearing which can gradually occur over the years, as in the child might have a normal hearing at birth, and if the child gets admitted in the ICU because of some other disease, which like some encephalitis or any other disorder, and the patient is kept in the ICU, what happens is the viral infection or something which will travel from the brain to the inner ear through some channels. So that time what happens, the child will start to develop these inner ear, hearing loss after this particular infection, that is meningitis. So then the hearing will start to deteriorate. The child might have developed a speech or not. So even in those children who have had a ICU admission, are mandatory to undergo hearing assessment after that to see if there is any further worsening of the hearing.